All right, good morning, and I'm Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Once again, unfortunately having to be in for Dr. Stites. We are coming to you from the Dolph Simons Jr. Family Broadcast Studio, and we have a packed Friday this morning. Luckily, we aren't alone in studio. To my right, I have Lance Williamson, who is Infection and Control Nurse Supervisor, to help answer some questions today. And to my left is Dr. Angela Myers, the Division Director for Infectious Diseases at Children's Mercy. And she's here to answer questions around vaccine and kids. And then joining us virtually is Chelsey Smith, Outreach Coordinator with Community Blood Center of Greater Kansas City, to tell us about a blood emergency. So, first, I do have the numbers to go over and update you with some very real and sad pictures. Right now, in the health system, we have 5 active infections, with 3 in the ICU and 1 of those on the ventilator. We also have 4 additional patients in recovery, so a total of 9 patients. But I want to talk about one patient in particular. I am on service this week seeing patients in the hospital, and our one patient that is on the ventilator is a patient who is also on ECMO. And ECMO is just basically a dialysis, like kidney dialysis, but it's for the lungs to help with gas exchange. And basically it is one of the very last steps, one of the very last life-saving measures we try to do to help people. This is a patient that is 54 years old, no other medical problems, but is unvaccinated. This is a fully preventable problem and disease process if people get vaccinated. So unfortunately, again, healthy, 54 years old, working, productive, but did not get the vaccine. Also, family members did not get the vaccine. Family members also have now COVID-19 as well. But again, a young person, no other medical problems. This could have been 100% prevented with vaccination. So very sad pictures. We are doing all we can to help this patient and get this patient out of the hospital in a good way. So. Well, Chelsey, the photos I just shared of this patient are sobering, but so is the news on the blood donation front as well. Can you tell us how critical is the blood shortage right now? Hold on just a second.
Are you muted?
Sorry, can you hear me?
Yeah.
We can hear you now.
Hi. Unfortunately, we've been in a blood shortage for the entirety of the pandemic, as we've been on multiple times having the same conversation over and over, it feels like. Recently, blood usage went up pretty significantly, and what that results in is a pretty significant shortage when we're not getting the same number of donors in that we were pre-pandemic. Actually, blood usage is up in our region. It's higher than it was pre-pandemic. So we are seeing that medical care is being rescheduled from patients that had to put off medical care in 2020. We believe that a lot of that is being rescheduled right now. Doctors are working through their backlog of patients, and there's a lot of blood going out the door, but not a lot of blood coming in. So we're sitting at about a 3-day supply overall and about a 1-day supply of our O's, which is incredibly critical because, as you know, we go through a lot of O-neg. We go through a lot of O-pos as well. So 1-day supply of that is not going to cut it for us. So we are officially on an emergency blood shortage, and we're hoping that donors are going to hear this message and come in immediately.
Yeah, absolutely. We know more cars are getting on the road, so trauma as well. I know walking through the ER yesterday, saw trauma come in and definitely was needing blood for that as well. So what does this mean when the blood supply does get so low? Who does it impact the most?
Yeah, it impacts patients the most. Definitely, it impacts the patients. We see tons of blood products go to our cancer patients who are receiving chemo treatments, lots to car accident victims, like you just shared. There's a lot of accidents that happen in the summer months, so the blood usage usually goes up anyway. But what we're seeing is these aren't normal numbers. And unfortunately, the people who are most impacted by that are patients in our local hospitals. So we're doing everything we can to make sure that our blood is getting to our hospitals so that patients aren't having to go without. But when we drop this low, it gets pretty critical. So we're hoping that we'll get donors in the door and we won't have to start shortchanging anybody. But yeah, it's very critical right now.
Yeah, and we know mask restrictions have been lifted. A lot of restrictions have been lifted. There doesn't necessarily seem to be too much concern out in the community about the spread of coronavirus, but what are you doing at your places? Are you still masking and distancing at the donor sites?
Yes, we are. So we're still closely following CDC guidelines that are set forth for healthcare settings. So we do require masks, and we are social distancing, enhanced disinfecting still. We're doing everything we can to make sure that our donor centers are safe and controlled environments for people to come to. We still have a good chunk of donors that have not returned since the pandemic. So it's about 25,000 donors in our general area. So that includes Kansas City, also St. Joseph, Missouri, up to the Iowa border, and into Topeka, Kansas as well. It's a huge geographical region, and there's 25,000 people who were regularly donating before that have not come back since. So safety is incredibly important to us because we need our donors to know that this is a safe and controlled place for you to come and be able to donate without fear of contracting coronavirus.
And that being said, how does a person donate?
Yeah, best steps are to go online to savealifenow.org. You can search via your zip code and find a list of blood drives near you. You can find a list of donor centers near you along with those hours. We do recommend that you make an appointment still so that we can anticipate your arrival, but we do allow walk-ins. At this point, we need anybody that we can get in. So if you don't have time to make an appointment, don't worry about it. Come on in.
Yeah, well, thank you. So please stay with us right now. As last time you were on, we had some viewer questions about blood donation. Don't go too far, and we will come back to you.
Sounds good.
So before we jump into our discussion, are there any reporter questions?
I have a couple. Cody with Channel 9 wanted to know, as more places reopen and rules relax, we're starting to see an uptick in cases nationwide.
Yeah.
The number of new daily cases and deaths of the coronavirus-borne illness rose for a third straight day, with cases topping the 20,000 mark for the first time in over a week. What are your concerns moving into the summer?
Well, Lance, I'll start with you.
I think it's a good point, and my main concern is, especially moving to summer, is maybe a false sense of security for folks who are unvaccinated. I think, as we see these restrictions lifted and changes happen on our journey kind of to stopping this pandemic, people are their lives are going to be less impacted the more and more we go. So I think that my main concern is unvaccinated folks will continue to have a false sense of security. So I think making sure that we can, your loved ones or people around you that are unvaccinated, continuing the message of how important this is because of the reason why we're seeing upticks here and there, depending on populations.
Yeah, and Angela, any thoughts about that from an adult perspective or that pediatric perspective as well?
Sure. So we know that children under 12 are right now too young to be vaccinated because the vaccine is only authorized down to age 12. So those kids still need to be masked. They need to still be careful in being in large crowds. Adults who are unvaccinated need to be masked and need to not be in large crowds of people. We still need to follow those safety precautions at this time.
Yeah, my main concern is we have been very fortunate, I think, here in the Midwest compared to some of our sister cities on the coast with hospital capacity issues. We have done very well. A lot of people have done the correct things. We know that certainly in the major metropolitan areas, vaccination is good uptake. We understand that in those rural communities, it's not as good uptake, and I think it just goes back to kind of what Lance is saying. My concern is increased cases, again, maybe leading to increase in shortages of workers, supply chain workers, first responders, things of that nature. So it's just very important to continue to endorse the message of getting the safe and very effective vaccines.
All right, and KCTV5 has a question about ivermectin. It's kind of out there again. Do we, or do you, rather, doctor, do you prescribe that?
No, right now we do. We are consistent with the NIH treatment guidelines, which does state there really isn't enough information to advocate for or against the use. There are studies out there. There are meta-analysis studies which look at a lot of studies and compare all of them. There are individual studies. Unfortunately, a lot of those studies are wrought with caveats and issues during the study design and analysis. So right now, we do not use that. Ivermectin is a FDA-approved drug for certain parasitic infections. However, with its mechanism of action, if you use too much, it can be toxic, and there can be toxicity associated with it. I'm still impressed that people would like to use this drug, not understanding the real possibility of toxicity, neurological toxicity, meaning you can have altered mental status, you can have problems with your brain, but yet they do not want to use something that is safe and effective like a vaccine. And this happens in kids too, and I don't know if Angela wants to speak to that at all, but neurotoxicity has been seen in children as well with doses that are too high. And what it looks like now is if you do use ivermectin, it really is only going to be effective in the very early stages, the viral stage of the disease process. Once you get probably past a week or 10 days of having any symptoms, there's not going to be any effect. I would certainly welcome randomized controlled trials, and I think we do need that to put the question to bed once and for all on if it is beneficial or not. But if there is any benefit, it's going to be very early in that disease process. But again, right now, we are consistent with the NIH treatment guidelines, which doesn't recommend for or against the use. Right now at the health system, neither me nor any of my ID colleagues would advocate for using that on themselves, their friends and family, or their patients.
Okay, that's all the questions that I have
All right.
right now for media.
All right. So Dr. Myers, thank you for joining us today. I know we didn't give you much notice, but thank you for being here. And we're getting a lot of questions about vaccination in kids. One common question is, how soon before those under 12 will have a vaccine?
That is a great question, and I don't have the exact answer for that, but what we keep hearing in the medical community is that it will be this fall. My hope is that it will be early fall, so right around the time school starts rather than late fall, and we'll be able to quickly mobilize and start getting younger kids vaccinated.
Yeah. What do you think about the reports of the mRNA vaccines being linked to myocarditis or pericarditis?
Yeah, so there have been several hundred case reports that have come across through the vaccine safety monitoring system. I want to just take a moment to explain that a little bit. That we have multiple different vaccine safety monitoring systems in our country, across our country, and they have shown us time and time again to be very effective in finding a signal, if there is one, that occurs rarely. And so the FDA committee for VRBAC, or the Vaccine-Related Biologic Committee, met yesterday with the CDC, and they've reviewed the cases that have been reported. And it does appear that the observed cases of myocarditis or pericarditis are a little bit higher than what we call the background rate, or what is expected in a community at a given time of year in young boys, so kind of that 16 to 24 age group. Now, I want to say that all of the data has not been analyzed, and some of the data showed a little bit of a higher observed to expected ratio, and some did not. So we don't clearly have a link identified at this point. There's going to be more analysis of the data over the next week or so, and the Advisory Committee on Immunization Practices is meeting on June 18th. So I think there's going to be more that comes out about this. It's possible that it's linked, but it's possible that it's not. It does appear that there may be a slight uptick in cases of myocarditis or pericarditis after vaccine than what we expect to be going on in the background rate of the population in boys kind of in that 16 to 24-year-old age range. But I want to stress that at this time, it looks like it might be somewhere around 16 per 1 million doses, which is why we wouldn't have seen it previously, because you have to give several million doses to then start finding this occurrence.
Yeah, and I would also say, these do look like transient problems, not too significant. I think it is important, just as with the ivermectin, is to ask the correct question and investigate that question in the correct manner to get the correct answer. So, we're still waiting on that, and we'll hopefully get some information. We know the CDC is going to be investigating that really soon here. So should parents continue to vaccinate their kids?
Absolutely. I listened to the Surgeon General speak yesterday. He did an amazing job, Dr. Murthy. And what he talked about was that the benefit of vaccination still far outweighs the risk of any adverse event from getting vaccinated. And I just want to stress that. That is a really important thing to consider. That we know that the risk of having myocarditis or pericarditis or myocardial dysfunction from having COVID infection or having had MIS-C, remember the multisystem inflammatory syndrome of children, far outweighs any kind of risk that we have seen or potential risk we have seen with vaccination.
And also, Mary Ellen had a good question. Should kids who are not vaccinated, particularly younger than 12, be allowed to go to crowded outdoor events or participate in summer camps? What is the risk?
Yeah, that's a great question. So again, it's all about your risk tolerance in your own home and what you think is okay to do. Is it okay for a kid to be at an outdoor event who's not vaccinated around a bunch of vaccinated adults? Of course. The risk of them getting disease is very, very low. If you're in huge outdoor events and you're unvaccinated, you should still be wearing a mask and you should still be taking precautions and trying to keep a bit of distance between you and the people around you. In terms of summer camp, the CDC has come out with some guidelines around that and around vaccinated kids not needing to be masked. But again, and especially kids who are staying in overnight camps and cohorting together. But again, you really have to look at what is happening at the camp, what are their infection mitigation precautions, and what is your risk tolerance?
All right. Well, thank you. That was a good answer.
It is. Can I ask a question? I'm just going to squeeze one in here. I just often wonder, because I'm a mom, right? And do you think, doctor, that part of the problem might be that parents are like, I don't think my kid's going to get this disease, and so I'm not going to take the risk on the vaccine, or adults even. Do you think that plays any kind of factor, and could you speak to how real is the risk that we might get it?
Absolutely. I think people absolutely feel like the risk to their child is low, therefore they don't need the vaccine. But let's think about that for a minute. We've had several million kids in our country get COVID-19 infection over the past 1.5 years, 1+ years. We've had over 15,000 kids hospitalized. We've had between 300 and 600 deaths. You don't know if your child is going to get COVID-19 or not get COVID-19 in any given year, just like you don't know if your child's going to get influenza in any given year. Both are vaccine preventable diseases, and even if the individual risk may be small, you don't know if it's going to happen to you or not. And we, as a society, as a community in general, want to be out and about with people. We want to gather. We want to be in groups. And the safest way to do that is to get vaccinated and eliminate your risk.
Yeah. And I think that's a great point. Right here in front of me, I have a recent morbidity and mortality weekly report that looks at adolescents 12 to 17. And their hospitalization rate compared to the last not the 2020, but other than that, the last 3 years of influenza, their hospitalization rate is more than double that of COVID compared to influenza. So you are at significant risk, even a young person, of getting to the hospital, much more than with influenza.
And there's no disputing that we still have community spread.
Absolutely.
All right, so are we ready for community questions?
I think so.
All right, our first one actually is going to go to Chelsey, so I know that she is still lurking. Lori says, I am O negative, but am on tamoxifen for breast cancer diagnosed last year. I was told last year I cannot donate for a year post-treatment, but don't know if that means tamoxifen.
So for that, I would defer to our medical team. We have a team on standby to answer questions specific to medicines like that. I would encourage her to go online either to savelifenow.org, or she can give our medical team a call. It's 800-688-0900. Call that number, give them your details, and we can answer those questions for you. It does vary a little bit based on personally what you're going through, maybe what symptoms you might have, what stage you're at, things like that. So to get a better picture of that, I'd have them go online.
And the next question is also for Chelsey. How long after getting the vaccination do I have to wait before donating blood?
So if you received an mRNA vaccination, you do not have to wait at all. You could potentially get your vaccine today and then go in and donate today as long as you're feeling healthy and well. If you receive, which I don't believe this is widely distributed or distributed at all in the United States, but if you do receive an attenuated vaccine such as AstraZeneca, there is a 2-week deferral period for that. But for the majority of vaccines that are being distributed now in the United States, there's no deferral.
Okay.
All right, the next question is for Stephen, and this is for Dr. Myers. Isn't the risk of COVID greater for an 11-year-old than the risk of the vaccine? I think you just spoke to it, but I want you to answer that again for me.
Sure, yeah. So the risk of COVID is greater for kids than the risk of getting a vaccine. Thank you for asking that question. Not only is the hospitalization risk higher, so Dr. Hawkinson just compared it to influenza and how the hospitalization rate is double, the mortality rate is also double from COVID-19 than it is from influenza. So I don't want us to underestimate the risks. The risks as a population are definitely higher for COVID-19 disease than they are for the vaccine.
And I think that's true for adults too. The risk of getting COVID-19 and any of its complications, whether it's respiratory failure, whether it's the blood clots, which can occur in the lung, in other arteries and veins in your body, in your brain, is much greater if you get the disease compared to if you get any of these vaccinations. So the vaccination is the way to go to keep yourself safe.
Okay, Jill has the next question, and not this Jill, but a Jill at home. Love your name. Right. She writes, and I'm not going to be able to say this drug, so I may have to spell it, but my grandson will be 12 in a month, and he plans on getting the vaccine. He is also due to start Dupixent, Dupixent.
Dupixent, maybe?
Okay. In 2 days, would it be best to delay the start of his medication until after he reaches full immunity with the 2-shot regimen?
So that's a great question. I'm not really familiar with that medication. However, the vaccine is indicated for all kids, whether they have an immune compromised condition or they're taking medication that causes them for their immune system to be lower. So I would say get the vaccine as soon as he turns 12. I wouldn't, if the medication needs to be started, I wouldn't delay starting a medication for the vaccination. I would just start it when that needs to be started and then get the vaccine as soon as he turns 12.
Yeah, I think that's a very good question to address with that medical team that's prescribing that antibody treatment.
Okay, let's start rocking through some of the questions left over from the week. And the first question is, someone I know suffered strokes after each dose of the mRNA vaccine. Have mRNA vaccines been linked to strokes?
I'll start with this, and anybody can kind of jump in. I don't believe that there's been a significant safety signal for strokes in the mRNA vaccines. Certainly, we've seen some investigations into the myocarditis, as we talked about earlier, but I am not aware of any significant, again, safety signals regarding strokes in vaccines. And again, we know that strokes can happen, and just because they happen around the time of vaccine does not mean they are associated. But certainly that is why we continue to have that reporting service so that people can investigate. The CDC, the FDA can investigate all those issues to look if there's any association or if there is an increased diagnosis of strokes, especially in people who have gotten the vaccine.
About 24 states have decided to scale back their daily tracking of COVID-19 cases. Does that worry you? What is the downside of not tracking the infection rate?
Yeah, so I think we will see this, and I'm not sure if this is testing or cases. I think it might be important to have some clarity with that, but we will see the way that we've been managing the pandemic for the last 15 months. There are components of that may not remain this whole time. So we will see changes in the way that we respond to this. I mean, since the vaccines came out, we've been talking about we've seen less testing overall, less numbers of testing. So then that calls into question how do we know how many people are getting sick? The good thing is, what we know is these vaccines are extremely effective and extremely safe. And so therefore, there may be some other components of the tracking and tracing that might change when we get to a different kind of subset of this pandemic.
Yeah.
So I think we will see those changes go forward, and I think it's important for us to ensure that we're following the current guidelines, and public health departments are going to continue to follow up on what they need to with COVID-19 cases, but that may change, as we go on and we live with COVID-19 for the future. We're going to have to just kind of tolerate this as we tolerate, the other diseases that we see throughout the year.
Yeah, I don't have necessarily an inherent problem with, going or scaling back the COVID-19 cases, because as we said, and Dr. Stites has said, really, I think moving forward, what is going to be the bellwether of how we are doing as a community, as a nation, is going to be the hospitalization rate. We know that people may have symptoms and may not get tested. They are weary from this. So I think, so overall, testing will fluctuate, be up and down, but I think just tracking COVID-19 cases is not going to give you the full answer. I think more telling is going to be the hospitalization rate and the hospital capacity moving forward.
That said, just remember that younger children are not vaccinated. So if your child has symptoms consistent with COVID-19, they should be tested so that they can properly isolate at home and you have an answer for their symptoms.
Yeah.
Will the health system continue to track cases, and where do you report that data? And we might ask that of Dr. Myers as well.
Yeah.
Sure. So yes, we do continue to track our cases at Children's Mercy, and that data gets reported to the state. So we report the data to our local health department, who then also reports it to the state the child lives in. So we are obviously located in Missouri, and we report that in Missouri. However, if the child lives in Kansas, it also gets reported to the Kansas Health Department as well.
Lance, anything about it?
Yeah, so same goes for us here on the Kansas side. We are required to report these cases to Kansas, who then will report to any patient's primary state of residence, and so that all will continue to get reported and then subsequently reported to CDC for national collection.
Yeah, we should say that we have a great team of infection prevention and control nurses who not only track COVID-19 cases, but track a lot of things within the health system, different types of infections, all reported to the state as mandated. So we do have a team on this to track, again, not only COVID-19 cases, but a bunch of other cases and infections as well, and we will continue to do that.
Some states report that they have vaccine doses that are set to expire. Dr. Fauci said the FDA might extend expiration dates. How do you do that? What and how are expiration dates set?
I don't have all the information on when and how, but I think they just extended the Johnson & Johnson expiration date by 6 weeks because some of those doses were set to expire. It all has to do with laboratory testing, making sure you have still adequate components of that vaccine that are not breaking down and that can still cause an appropriate immune reaction and immune response. So
yeah, and the FDA in their release for that talked about how they used data from stability studies of these vaccines. So we will continue to see studies on how stable these vaccines are in different environments. That couldn't have happened, when we were really needing to get vaccines in arms. So the more time we have, the more science and data is available to us to apply to these vaccines and help us really use these in practical settings.
All right. Is it true that as more adults get vaccinated, the virus will plague children who are not vaccinated or can't be vaccinated?
Yeah, that's a great question. So what we have seen as more adults are vaccinated, and as Dr. Hawkinson mentioned, less hospitalizations are occurring, we have seen a relative increase in the proportion of children being hospitalized and being in the ICU. Because early on in this pandemic, adults were the ones primarily who were getting very sick and being hospitalized and then needing ICU care. As that has decreased, again, the proportion of children needing that care has increased, which is why we want to stress that all children 12 and older get vaccinated at this point, and then as soon as we have the authorization for younger children, that we get going on that as quickly as possible.
Yeah, and the virus is going to want to find a healthy or unhealthy non-immune host. And it will just find it because we know it's out there in the community. So just as Dr. Myers had mentioned, it may not be a total increase in the number, but the proportion in certain populations may be increasing. So again, it is important to continue to do these measures if you can't get vaccinated. And when you can, please get vaccinated.
I have a related question before we go to the next one, guys. Ardith is asking, and I just hope you can help her. My 5-year-olds just started back in-person speech therapy and occupational therapy. Their therapists are one-on-one with a vaccinated therapist. Their therapies are one-on-one with vaccinated therapies. What should I do when I get home? I've been changing their clothes, washing their hands. Do I also need to give them showers after each session?
No, you don't need to shower them. Washing hands is always a good idea, so we're never going to say no to that one. And if anything we've learned throughout this pandemic is that none of us probably washed our hands enough prior to the pandemic.
Yep.
But changing their clothes or taking a shower right after is not necessary. The fact that your children are with a vaccinated healthcare worker doing their speech therapy is awesome, and their risk of getting COVID-19 is negligible from that situation.
Okay, let's go to the next question. Air travel is surging with bigger crowds. Is it safe to fly this summer?
If you're vaccinated, then I would say yes. Again, I think our focus on unvaccinated folks is your risk is going to be a little different in those settings. And as we know, crowded airports and even planes can be places where transmission occurs. So it's all about your risk tolerance, I think, and what you want to expect. But definitely, if you're concerned about that, your first step would be getting the vaccine.
Yeah, and I would say, yes, it's safe if you're vaccinated. I would say continue to get people around you vaccinated. Any parties that you are traveling with, make sure everybody in that party is vaccinated. But also when you're flying, I think it's still important to continue to wear masks and eye protection as well, especially in the plane and in those situations, because you have to assume that not 100% of the people that you are around are going to be vaccinated. But I think if you're vaccinated, I think it would be safe if you can also take those non-pharmaceutical interventions with you as well, which is masking and distancing as much as possible.
All right, is it safe for my boys to return to their martial arts lessons? They are too young to be vaccinated.
That is a great question. So I think it depends on what they're doing for mitigation in the martial arts class. Are the kids all wearing masks? Are the instructors vaccinated? They're enhanced. Is everybody washing hands before they get started? Or are the kids kind of spaced apart? You really need to know what their mitigation strategy is and ask all those questions to kind of make that decision. But if you're in a situation where, yes, all the instructors are vaccinated, the kids are all wearing masks, they're spaced apart from each other while they're doing their lessons, then, yeah, I think it is safe. You just kind of need to confirm all those things.
Yeah, and I would agree, and this kind of plays on one of our first questions, Angela, just about, the number of people that are susceptible to the virus are going to be infected. But if you can help stop those transmission routes by having all the adults or all those people that are eligible for vaccination vaccinated, that will help stop the spread and the transmission, especially to those people who cannot yet be vaccinated.
The Sedgwick County Health Department is cutting their hours of operation as demand for vaccine drops. But Sedgwick County has half the new variant cases. Is that smart?
Yeah, I think it's a balance of the workforce and the what's needed to keep those vaccine distribution keep those running. When we see that there's less uptake of the vaccine, I think we have to change our plan for how we get vaccine to people. I think most people have noticed that there's been a lot of campaigns in different states on, getting people motivated to get the vaccine. I know that the racetrack, you could ride your car around that. So we'll see more of that. And I think as we go, with that first kind of 150 million people vaccinated. It's going to be a continued issue of trying to get more vaccines to folks. So we will see that in doctors' offices, in mobile clinics, at stores like Walgreens. So that will change, and these mass vaccination clinics will need to kind of redistribute their processes to those more individual basis.
Yeah, and I think what's not smart is a continued vaccine procrastination or hesitancy. We are happy to address questions, but the information is out there, the accurate information, again, showing the safety and showing the efficacy of these vaccines. We do also know that in rural counties, the vaccine uptake is less. Just having the health department cut their hours a little bit, that's okay. There still are other realms where you can get the vaccine. Your primary care clinics, health systems or hospitals, the private pharmacies. The vaccine is out there. We just need the uptake of that vaccine. The patient that I described and we showed pictures of from a rural county where uptake of the vaccine is not very good. So hopefully this will spur. We know that communities in those smaller or those rural counties are small and everybody knows everybody. Hopefully this will spur now a new vaccination wave in that community to keep other people safe as well.
Okay, Linn County, Missouri continues to have some of the highest infection rates in the country, and now COVID-19 hospitalization rates are up in southwest Missouri. Is this spike in cases from Linn County?
Again, without knowing the exact geography or geographics of that, going back to, we know that in the United States in general, the metropolitan areas have a higher percentage of vaccine uptake compared to rural counties. So I think it's important to get those people in those communities to understand these are people you live and work with every day. We know those communities are small and people are integrated with each other. Understand and seeing what is happening with those people that they love in the hospital. Hopefully that will spur more vaccine uptake in those communities. So I don't know that they're necessarily linked, but I think it's more of a theme of just areas where there's not enough vaccine uptake, where there could be more.
Yeah, I think it's difficult to confirm that kind of causation, but as we know, when there's differences in state requirements, the vaccine or the virus does not care about state borders or country borders. So we will see that other populations are impacted by outbreaks that occur and neighboring communities. So I think it's important to keep that in mind, that the pandemic is a global issue, and so when it's over for all of us, that means it's over. So you may see outbreaks occur in certain populations, and those could impact states or communities. And so going forward, I think it's a good concept to remember that those outbreaks will impact the populations around them.
Yeah.
Okay, so we have one more printed question, but Mike has written in with a good question. It may be a little bit of a brain teaser,
Okay.
and so I'm going to save Mike for the last. But here's the last printed question. I am worried that there are clearly sick people in my workplace. They're coughing and sneezing. How do you know if it's a cold or COVID-19?
Lance?
Sometimes it's difficult because we've seen varied symptoms with COVID-19. I think we are all aware of what a cold looks like with sniffling, maybe some sneezing or coughing. I think in terms of going forward, we need to look at symptoms as a risk of transmission really in general. So masks are normalized in our communities now, which I think is a good thing for all of us. There are countries that have used masks for decades, irrespective of a pandemic. When you're feeling a little off, you're feeling sick, and you still have to go to the grocery store, you have to go to work. I would really hope that that employers have policies that make it so it's not punitive if you need to stay home if you're sick. So that's something I would pursue if I was concerned about that. And then also we know that there are just some really great basics that we can hold on to keep ourselves safe from symptomatic folks. hand hygiene, wearing a mask if you're sick, and then even going back to something that we haven't talked about in a long time, just like respiratory etiquette, covering your cough in those settings. Even when people are taking off the mask, that respiratory etiquette of using a Kleenex and washing your hands after you sneeze, those things are going to help prevent transmission as well.
Yeah, I think an easy answer is go get tested. And even if you are sick and ill, we have this in the hospital, even with our physicians that need to be seeing patients every day. If you're ill, please stay home. And it's hard for us because we want to see our patients, but we also know we can't put them at risk at further disease. So the easy answer is please go get tested, and then, again, try to take in all of those other components that Lance just talked about.
Okay, and for our final question today, Mike says, at the heart of it, he's looking back to when the J&J vaccine was paused because there were concern over blood clots. And he's wondering, why aren't they pausing the mRNA vaccines over concerns of myocarditis? He says, it seems inconsistent to me.
Well, that's a great question. Keep in mind that these children who have come to the hospital with symptoms of myocarditis have rapidly improved, predominantly with just taking some ibuprofen or nonsteroidal anti-inflammatory like Motrin or naproxen. So it's not the same situation as there was concern for the blood clots. So we can't equate the two.
Yeah.
They're completely two different situations. This one is potentially a mild myocarditis or inflammation of the heart after having predominantly dose 2 of the vaccine that resolves within a few days.
I think it's because it's got the heart, and it just
Yeah.
sounds scary.
But I think
when you're
well
a
said.
parent.
This is a transient issue. This wasn't leading to the significant complications that the blood clotting issues were with. Prior to this myocarditis in these young persons, we have a previous track record of 1.6 or 7 total billion doses total of COVID vaccines given, which have a very good safety record. So it is a little bit different there. Yeah. All right. So Monday is National Blood Donor Awareness Day, and we have been planning a special update for some time. We'll be back to the Community Blood Center and watch as a longtime donor gives blood and listen as he shares his story. We'll also hear from a mother who received a life-saving donation during childbirth. And we will hear from Chelsey again. So we will go to Chelsey first to hear her final thoughts, and then with Dr. Myers. Chelsey.
Yeah, I think final thoughts for us as our communities try to move forward and return to some semblance of normalcy. I just want to remind our public that we at the Blood Center are not there yet. We are still very much affected by this pandemic, and we're going to feel those effects for a long time. And we are at the mercy of our blood donors. The only solution is to get more donors in the door. So really encourage you, if you've got a free hour in the next few days, please come in and donate. It does make a difference in your community.
All right, absolutely. Dr. Myers.
Sure. So please, if you have questions about getting vaccine yourself or vaccines for your child, please go to our website at childrensmercy.org and look at the information that is available for patients and families. Ask your pediatrician. Please reach out. We are happy to answer questions. We are happy to dispel myths that have been kind of, perpetrated on social media. We are happy to walk through that with you. And we just want people to feel comfortable and safe getting the vaccine because we know that it is safe and effective.
Lance?
I think going into the summer and some restrictions lifted, my main concern and final thoughts is just kind of take care of anyone in your family or your loved ones who are unvaccinated, see how you can inform them, answer their questions, understand where they're coming from, and I'm just wanting to make sure that those folks don't have a false sense of security when we're going into the summer months.
Yeah, I would kind of play on that. Keep yourselves healthy as we go into the summer months and have vacations and activities and camps. Get the kids vaccinated. My children have been vaccinated, and as we say goodbye, I want to give you an update. As of last night, the kids were doing fine. There was not even any arm or shoulder pain. They got their second dose yesterday, and unfortunately my daughter had to go to the dentist as well to get some dental work.
Which dose did they get? Pfizer, I guess that's
They
the
got
only one
Pfizer,
available. Right.
second dose. So, it's safe, it's effective. Moving forward, they are going to be able to continue to participate, not be held out of activities. So please get yourselves, get your family vaccinated. We have plenty of vaccine here at the health system. You can call 913-588-1227 to schedule an appointment, or log on to kansashealthsystem.com/vaccine and follow the prompts to use MyChart. So please call and schedule your shot now. So thank you, and we will see you on Monday.